figure out where you keep going wrong, and I can nip this Cuddy thing in the bud before she becomes the fourth ex-Mrs. Wilson. You have to have sex with Cuddy.
How do you feel?
Sleeping a lot. That's normal after radiation.
I'm getting a murmur.
Oh, my arm. It's hurting me.
How do they audition actors for the patients in this series? You've just grazed your knee. Sell it to me. Oh, it hurts. You call that a performance? I said sell it to me, not sign me up to your newsletter of sympathy times. Next, very excited to be reacting to House MD Season 3, Episode 20, House Training. On this channel, we are reacting to all 177 House videos, and this will be episode 78. Let's see if I can get the diagnosis before House does as a doctor working in London.
Which one is it? Which one is it?
It's right there.
Right there? Bam! You wanna double up? You will not win again. Find your queen. This one? Oh my God, it's killing me. This is the last time I'm not messing with you no more.
I can't decide. I can't.
You try to win a $20 illegal gambling game and win yourself a bruised head and a $2,000 hospital bill. So what can cause Our Lady on a hot streak to lose her edge and collapse? There was no limb jerking, so we would call this syncope or fainting. There are 4 different types generally. Cardiac could be from abnormal heart rhythms or structural disorders like hypertrophic cardiomyopathy or a clot in the lung. Brain vascular disorders like vertebrobacillar insufficiency, where there's poor blood flow to the back of the brain. Disorders of vascular tone, like when your vagus nerve overfires, dropping your blood pressure, or you drop the pressure on standing, coughing, or even pooping. It could also be something that mimics fainting, like seizures or metabolic disease. We definitely want to start with blood tests including glucose and an ECG with lying and standing blood pressures, and a CT scan of the head if there are any brain signs when we examine. The truth is though, even with all those tests around, half of people who've had a collapse like this don't have a clear diagnosis when they leave the emergency department. Which side will she be on? Let's find out.
It's called abulia, the inability to make a decision or exercise will. It's part of a TIA, a transient ischemic attack.
Loss of free will. Maybe we can get Thomas Aquinas in for a consult. If you find the toxins, you run your bubble study. You won't find anything, I'll get the office to myself. There's a lot of porn piling up on the internet.
If you ever want to see what fluorescent wallpaper looks like, buy House a gift for his office, a UV lamp. Interesting that House was talking about Thomas Aquinas in a case about the freedom of choice. You see, Aquinas' definition of freedom is pretty contrarian to the current definition, which is to opt for a choice without external pressure. Aquinas' idea of freedom states that free will is hungering for the good, which is what makes us truly happy even if we don't feel like choosing that choice at that moment. He also then goes on to say that the true reason for our freedom is to find God, and nothing else can help you achieve true happiness. Aquinas says using your free will to choose anything else, like money, status, or honor, will chain you to the ground by making you addicted to the things which are not good for you. Even though some of Aquinas' ideas were revolutionary, this one sounds about as liberating as Guantanamo Bay. But how will we liberate this patient from her symptom? It sounds like the team thinks she's had a mini stroke or TIA, which is a tough one to diagnose, as by the time you try and scan for a clot, it's already gone. Usually it works by objectively seeing or appreciating a patient's sudden onset neurological symptoms that miraculously disappear in the next 24 hours. If that happens in real life, we need to urgently find the cause of the clot, and where do they usually come from? The heart. So we get an ECG to make sure the heart rhythm is okay. We look for the superhighway leading from the heart up to the brain, known as the carotid arteries, to see if they've been furred up, and check blood tests to see if someone has high cholesterol or diabetes that could make them susceptible to the disease. We then give them antiplatelet meds so that the clots don't come back again. So that's the usual path, but then we have the House path. Foreman thinks the lady is on drugs, but her tox screen is negative, so he's going looking for rare causes. Cameron thinks the heart is throwing off clots, so wants to do a contrast echo or a bubble scan of the heart to get more info. That would be useful if there's a hole in the heart, and so the clot could have come from the legs into the right heart and then through the wall up into the left side and into the brain. We call that a paradoxical embolism, and it would be a pretty spicy diagnosis. Let's see if it's the case.
Hello, Mr. Foreman.
Why are you here? You didn't bring Mom with you.
You haven't been home in 8 years. She should see you. while she still knows who you are.
Building this all could be toxic exposure anyway.
Or it could be drugs. Drugs can be laced with toxic substances. Arsenic, rat poison.
Exposure could come about any number of ways.
Absolutely. Except for the crack pipe.
I only want to know if you're happy.
I'm okay.
I don't do drugs.
Get a crash guard in here. Respiratory arrest.
Oh, seems like this episode is going to be digging into Foreman's past experiences with his brother. It's interesting that the dynamics almost have reverse racism going on here. Chase accuses Foreman of sticking to the idea that the patient's using drugs because of her race. We know Foreman has a brother that got into drugs and ended up in prison, which could give the theory some firewood. Chase wants to give her the benefit of the doubt and thinks it's toxins that have caused the deterioration. It raises an interesting point. We often think of racism that happens as a result of other races or institutions, but what happens when it becomes internalized? Like Suella Braverman wanting to ship migrants to Rwanda even though her parents were migrants, or Mexicans voting for Trump. The appeal of the perceived social narrative can become so strong that even people of a certain race can accept that hierarchy and apply its rules. If aliens do exist, then they must think we are a peculiar bunch.
I need you to stay still now.
There's a mass just outside the lingula.
Biopsy shows there are white blood cells in the walls of the blood vessels.
It's gotta be autoimmune.
Start her on steroids.
That wasn't my crack pipe. I just took a hit off it a couple of times. And because you got out of the projects, you think that anybody who didn't is weak and stupid.
Of course, Forman will deny that allegation, but the idea of if I did it, then so can you is pretty fundamental to human existence. I'm very interested in this area as we know that higher incomes are associated with better nutrition, housing conditions, and availability of healthcare. So how easy is it to change your financial situation in the US and achieve the American dream? Well, in the US, just 8% of children raised in the bottom 20% of income can climb to the top 20% as adults. Numbers from Denmark are almost double that at around 15%. That has a massive impact on young people's outcomes as well, as your life expectancy in the US can vary by 20 years just based on your zip code. In case that wasn't enough, there's more. The top 20% of US earners make 9 times more than the bottom 20%, and the bottom 60% of the country own less than 1% of its total wealth, which is much lower than in EU countries. If that doesn't change, then the American dream may soon become a distant memory. Anyways, our patient probably isn't going to start her Amazon FBA side hustle unless we find out what the white cell mass in her lung is. The two main things could be lung cancer like small cell cancer with a paraneoplastic syndrome, or a granuloma, which is a walled off lesion that could be due to a ton of things including TB, aspergillosis, sarcoidosis, or even rarer things like borreliosis. The team said they think it's autoimmune, so vasculitis like Wagner's or rheumatoid arthritis could do it, presenting like this. Blood tests with an autoimmune screen would be helpful here to check for antibodies, complement levels, and then take it from there.
You make bad decisions every day of your life. Stop doing drugs, stop having fun, go back to school and get your GED. It's yellow in the sclera. First brain, then lungs, now liver. Lymphomatoid granulomatosis. She needs total body radiation.
Start the radiation. I can figure out where you keep going wrong, and I can nip this Cuddy thing in the bud before she becomes the fourth ex-Mrs. Wilson. You have to have sex with Cuddy.
How do you feel?
Sleeping a lot. That's normal after radiation.
I'm getting a murmur.
Oh, my arm. It's hurting me.
How do they audition actors for the patients in this series? You've just grazed your knee. Sell it to me. Oh, it hurts. You call that a performance? I said sell it to me, not sign me up to your newsletter of sympathy times. Next. British reactions to pain where I work are very different to what you see here. One 27-year-old female patient came to see me in the clinic and she said that her big toenail had been growing in the wrong direction, so she picked it off herself and tried to cut it off with no anesthetic. Definitely something I don't recommend doing, but even though her injury looked incredibly painful, you would think it was her birthday until she took off her sock. So now our team think the patient has lymphoid granulomatosis and have irradiated her whole body. Why? Well, she has a mix of symptoms which is jumping from organ to organ, meaning it has a multi-system disease process. And we know immune cells are involved. The disease is known to affect the brain, lungs, and liver, but also the kidneys as well. I hope it's not this though, as it's a type of cancer due to rapidly expanding white blood cells, and most people don't make 18 months even with treatment. The condition is known to be related to a virus called Epstein-Barr virus, which more commonly causes kissing disease. What if she has that virus but not this complication, and has another one of the tens of different complications, including hepatitis, spinal cord inflammation, breakdown of blood, and even muscles? Foreman did say he heard a murmur though, and she's gotten worse after the radiation, so she could have infective endocarditis that's throwing clots off to the rest of her body. That's going to be my first diagnostic guess.
Just the pressure of the BP cup was enough to start her screaming.
Sounds like she's septic.
It's an infection and we fried her immune system.
Do an echo to confirm it's in the heart. We just killed her.
I'll tell her. You're dying.
How much time?
Less than 24 hours.
What? Now you decided to invoke your oracle powers, Foreman? Could have done that before you made her marrow about as alive as respect for the Canadian Parliament after they gave a standing ovation to a Nazi. The truth is though, predicting when someone will die is actually very difficult. When I was on palliative medicine, I looked after hundreds of people who are dying, and the way we predict when there's about 6 months left is how quickly things are getting worse. If they notice their mobility getting worse over months, then there's likely months to live. If eating is reducing over weeks, then it's weeks to live. If conscious levels going down over days, then there's days to live. One thing I can tell you for sure though, people who predictably have 1 or 2 days to live do not look like this lady. They won't be speaking to you coherently or necessarily even aware of their environment, unless they're Queen Elizabeth II, who was doing public appearances up to 2 days before her death. But those timescales only really work for when things are taking a predictable course, like in cancers or organ failure. Sudden conditions can strike and cause deterioration unexpectedly at any time. So take the time to enjoy the moments with your loved ones, because you never know when they could be your last. That doesn't mean take out a bank loan and book tickets to the Maldives, but be present. Ask about them, really listen and connect. By thinking and caring about others deeply, you ultimately benefit both them and yourself. Maybe Foreman will use this as a reminder that he needs to patch things up with his mum. If you enjoy being present for my house reactions though, then check out the channel membership. You get early access to new videos, access to exclusive polls, and to suggest a series and episode for me to react to. The first 30 members have a chance to win a 1 hour one-on-one tutor session with me on a topic of your choice, and we currently have 29 members with just 1 spot left. I'll keep working tirelessly to make it worth your while.
Yesterday, you thought I had a chance.
There's nothing anybody can do.
Get out! Get out!
I think it's broken.
We still don't know what infection.
It's not gonna help her.
What did we screw up? What did we miss?
We'll have to wait.
When I go, the world's not gonna be any different. Kind of a relief for you, huh?
I've made some bad decisions, robbed houses, but then I got another chance. There's some part of me I can't get rid of. Always thinks I'll figure out I'm not supposed to be here.
Okay, I hate to break up this beautiful heart-to-heart, but I needed to alert you to the tiny fact that she could still live. Generally, if we have no idea what's killing someone and they have a pretty good functional state like this lady, then we try to give them some medicine before making a referral to Jesus. If they know it's infection, then they have first line, second line, and third line antibiotics they can try along with antifungals. Yes, your immune system is helpful, but some combos of antibiotics will still kill just about anything. We also don't know what the jelly scan of her heart showed, or if they've tried to culture her blood to see what it grows in the lab. There are basic things to be covered before asking this lady what type of petunias she wants at her eulogy. Either way, we're getting some very interesting character development from Forman here. What he's describing, the feeling that you don't deserve to be where you are, is called imposter syndrome. It's extremely common, and 70% of people experience it at some point throughout their lifetime. I'll never forget the time when I first experienced it, when during my research masters, my professor walked around the room and said, "We made a mistake in one of your applications and you got in by accident," without saying which one of us it was. My palms got sweaty, my legs started to twitch, and my heart was racing. A part of me felt I didn't deserve to be there. It stems from the idea that people have an exaggerated view of our abilities when we know deep down we aren't all that smart or worthy. Part of the problem can be downplaying your achievements, as even though humility is admirable, we begin to believe the narrative that we communicate. To counteract that, celebrate your achievements when they happen and set tangible goals so that when you do hit them, you have stone cold evidence that you can't be as much of an imposter as you think you are.
You're out.
I'll never be out of there. When I came home, That last Christmas I was in college. It was suffocating. My mom put her arms around me. That was the last time I ever felt at home. I only put distance between you and me because I know there isn't any.
Aren't you ever gonna leave?
No.
Even House was wrong.
Her bra hook. That's how the infection got in. Staph aureus.
What? Guess what Staph aureus is the most common cause of? Infective endocarditis, which was my first and only diagnostic guess. I can't believe the team would have missed this, as scratching yourself with a bra hook and getting an infected wound isn't something that you just merrily go on your day with. It also would have been very noticeable on the blood cultures, which they would have done as protocol when she began to get unwell and her inflammatory markers went off the scale. Definitely not a zebra by any means, as I've seen and treated many patients with this exact condition. She got hers from the skin, but people can get them from intravenous drug use or even poor teeth hygiene. In fact, tooth hygiene is so important that before we replaced someone's heart valve when I was on cardiothoracics, then we would pull out people's teeth that were infected to make sure that they don't re-inoculate the new valve. One 40-year-old patient we treated had to have all his teeth out except one front tooth. Poor guy. It's quite important, as the heart is very poor at getting rid of valve infections, even with antibiotics. That's because valves are not vascular at all, and there's no real way for antibiotics to penetrate that deep. The brain symptoms, the lungs and the liver could all be explained by abscesses or rogue clots flying around, and this would be treatable with antibiotics. I love the character development in this episode, but the patient dying with this condition undetected would be beyond unheard of in the modern clinical world.
She died from a simple staph infection?
I killed her.
Yeah, me too. And you'll do it again. I can't forgive you, Foreman, because there's nothing to forgive.
Well, I forgive you.
Do you know who I am, Mom? It's Eric.
Of course. Our little boy's name is Eric.
Oh, what a brutal ending. That home Foreman mentioned when his mum hugged him. It's gone. The way his mother and House comforted him were in completely different ways. House killing the emotional side but healing the existential, and his mother doing the exact opposite, giving comfort but surely making him wonder if he'll ever feel at home again. The reason why House said there's nothing to forgive though is because their alternative way of practicing medicine is why they save so many people. That may work well for when you get these zebra cases, but every doctor, no matter how subspecialized, needs to be able to deal with the basics well. This kind of reminds me of the way professors can sometimes treat patients on the ward. They spend a lot of time reading about and researching complex enzymes with breaking science and doing conference presentations with huge funding. But when they come to the wards, they sometimes use outdated medicine and methods, as they aren't as in touch as the usual consultants are. It can also be that they're intentionally wanting to provide alternative methods to distinguish themselves from the crowd, but that could end up with worsened care. Of course, that isn't true for all professors, but has been my general experience in clinical medicine. If a doctor's treating me, I don't want the one who has spent time writing papers or researching that disease. I want the one who is in the trenches day in, day out, who knows how to manage it in an up-to-date way as a second nature. Great episode, but way off in terms of accuracy. I just don't see how this patient could have died in this situation. I'd say 6 out of 10 entertainment, 2 out of 10 accuracy, I'd say 3 out of 10 diagnosis. This episode doesn't make full sense though until you watch the previous one where a mother refuses to give up here.